Hello, everybody. I'm very delighted to have Dr. Dange with us. He's a renowned expert in the field of neurosurgery, a senior consultant, and an endovascular surgeon at Global Hospital, Mumbai. He is with us to shed light on the important and critical issue of strokes in India. India is a very populated country, and we have 1.8 million cases of strokes every year. It's one of the leading causes of premature deaths in the country, and yet the awareness that we have towards stroke is extremely less. Thank you, Doctor, for joining us to throw light on this extremely critical healthcare issue that we are facing today. So, Doctor, to begin with, could you please help us understand what is a brain stroke?
Yeah, surely. Good evening, and thank you, Nitya, for bringing this important topic to the society and the viewers. So, brain stroke is a very important subject, and to understand it, we should define it's a medical emergency. Basically, when there is sudden, abrupt cutoff of circulation to a part of the brain. So, this happens primarily due to two reasons. One is sudden blockage of a vessel due to a clot, what we call as a ischemic stroke. And there's another where there is a rupture of the blood vessel, which we call as a hemorrhagic stroke. Now, it's worth noting that the ischemic stroke, what we in layman call as a blockage stroke, is more in incidence, about 87% of all the strokes in common. So to identify or understand, stroke is nothing but a part of the brain gets deprived of circulation or food as a sudden onset. And it's always a sudden, which we have to be careful about and which is very common in our society.
Thank you, Doctor, for explaining the different types of strokes. It's good to know the difference between them. Moving on to our next question. Is there any symptoms that we need to look out for? Like, will we be, so that we can be prepared that, a stroke is going to come? Is there any prominent symptoms that are there for stroke?
Absolutely. It's very, very important to diagnose stroke and understand when a person is suffering from stroke. To remember this, we have designed an acronym called as FAST. FAST. This represents the symptoms of acute stroke. So these symptoms, which is like F, stands for face drooping. So face becomes crooked, or one side of the face or the angle of the mouth starts drooping. Then A stands for sudden onset, one-sided arm weakness, or half of the body becomes weak or loose. Then S stands for speech difficulty, or there is sudden onset difficulty in expression or naming. And then T is time is very crucial. If any of these symptoms occur suddenly or in combination, it's very important. These are labeled as symptoms of stroke. One has to identify, and the person nearby to the person who is suffering from stroke has to raise an alarm and take these patients to the nearby stroke ready center.
Okay. Okay, so just to get an understanding, the person who is with the patient is the one who needs to understand these symptoms, and they are the one who needs to take them to the hospital, right? So
Absolutely.
everyone needs to have an awareness of these
Exactly.
symptoms.
That's the most important message we have to convey, that
Hmm.
the person may be not aware what he's suffering from. If he's developed a stroke, he may have hemiplegia, he is not understanding, speech going. That can be a part of not able to understand what's happening to that person. So it's very important the near and care, the friends, the society have to have a high index of suspicion, awareness of the stroke symptoms, be fast or fast, where there's addition to this fast, there is also another symptom called as balance, loss of balance or eye symptoms. These are the symptoms which together one has to identify if one is going through a stroke, and these are alarming symptoms. These have to be having an immediate attention. That attention is very, very important. That's why the term T T times stands for T indicates time, and one has to take these symptoms into immediate attention and report to a stroke ready center. So time is crucial.
Thank you, doctor. I'm sure this would have helped our viewers understand the urgency of stroke. Now, this takes me to my next question. That is there any preventive measures that we can follow to reduce the chances of stroke?
Absolutely. Everything what we say is prevention is always better than cure. And so it's applicable for the strokes. And believe me, 90% of the strokes can be prevented. So it's very, very important to understand stroke is a deadly disease and one can take precaution, cure and prevent it. That's the most important part of one should not suffer from a stroke. That's always we pray to God. But how do we prevent it? 90% can be prevented, but what are the ways? The most important ways of preventing is adapting a healthy diet, regular exercise, then keeping away from smoking, excessive alcohol. Then we have other ways of preventing it is regularly monitoring somebody is having blood pressure, high blood pressure, or diabetes. So these are very, very important high risk factors which can be controlled. So what is more important is to prevent, one has to understand to have a healthy lifestyle. And that's very important to promote and make our society aware of these preventable factors which can be inculcated in our day-to-day life so that you start exercising, having a healthy lifestyle. It's very important to preach, but of course it is very important to understand that stroke is a deadly disease. It is better to be having a prevention rather than somebody suffering from it.
Understood. Okay. 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 So, just to get an understanding, in conclusion, stroke is definitely a critical health condition. But, however, due to simple lifestyle changes, right, by leading a healthier lifestyle, we can reduce the chances or and the impact of stroke. Correct?
Absolutely.
Thank you, doctor, for spending your valuable time with us in educating us for this on this extremely important topic. Thank you for joining
Thank you.
us.
Thank you for having this very important discussion and very valid and important points where the society and the laymen are supposed to know. And it's very important to have awareness amongst our population. Thank you.